What do Rosa Parks and the thousands of civil rights protesters from 50 years ago have to do with combating rising healthcare costs in our country today? Remember the great generation of American patriots who fought for civil rights in the 50s and 60s? They showed us the way. They showed us how to fight the status quo and proved that their strategy works. They risked their lives to fight injustice and to protect their rights by taking their proper seats on buses, at the lunch counters, and in the classrooms. And that simple act of civil disobedience produced astounding results. Their arrest created publicity, and that publicity changed America. We are going to do the same thing. At a designated date in the near future, a patriotic American is going to walk into his or her physician's office, sign in, and when the doctor comes in, they're going to make a statement to the effect that, "I will pay a fair price for your services, provided you disclose those costs to me in advance. A fair and reasonable request, I might add." And when the doctor refuses to disclose those fees, that patient, that patriotic American, will refuse to leave. And when that patriot is joined by 4 or 5 other patriots who also refuse to leave their exam rooms, then that practice will come to a grinding halt. And when that happens, the police will be called, the patriots will be arrested, and the next day, on the lawns of the practice, will be hundreds, if not thousands, of protesters. The press will come to cover the event, just as they did in the civil rights demonstration. And the movement will spread from one practice to another, and to another, and another, until the momentum reaches the tipping point. At this point, primary care physicians will have to take a good honest look at themselves in the mirror. Are they violating the Hippocratic Oath which says first do no harm, when they inflict financial hardship or ruin on their patients? When their recommendations force patients to choose between food or medicine, between paying their mortgage and paying the hospital bill? Doesn't financial harm create stress that negatively impacts a person's health and further reduces their quality of life? The idea that a medical decision can be made without consideration of cost is ridiculous. So the question is simply this: who is the Rosa Parks of 2009? Who among us will be the first to accept personal responsibility for reducing healthcare costs in our country? Who among us will be the first to demand information that we should have anyways? Consider this. Many of us will see a doctor, either today, tomorrow, next week, or at some point in the near future. And you will be, and we will be, forced to make an honest assessment of yourself as an American and as a consumer. Are you a sheep, content to follow the herd to financial ruin? Or are you a wolf, prepared to fight for your financial rights, and in doing so solve what may be one of the greatest problems this country has ever faced? I say, be the wolf. Exercise your freedom of speech and the power of your pocketbook. The only ones that think that we can't get what we want are the politicians in charge. But remember, if 300 million Americans can beat the crap out of, rhetorically speaking, 250,000 physicians, then 456 congressmen shouldn't be much of a problem. Now, the irony of the recession is that with so much going wrong, we have both the opportunity and the leverage to force cost disclosure at the point of care if we have courage. The healthcare industry is in line for an adjustment, just as every other industry in America. We must be vigilant to make sure that adjustment does not come at our expense, the taxpayer. Remember that politicians didn't alter the status quo with respect to civil rights. The people did. Regular, hard-working people like Rosa Parks and the thousands of people who protested alongside her. People who had had enough, who demanded change and were courageous enough to take action. First, by hitting the powers that be and their pocketbooks. And second, by exercising their rights at the polls. So I say, be the wolf. Okay, so if you're like me, you're convinced that the only way to achieve real cost reduction in our healthcare system today is to have cost disclosure at the point of care. If you're like me also, you have little confidence in Congress's ability to enact legislation that will protect your interests. Therefore, it's time to act. I implore you to visit sitinrx.com. Go to the site and register. Registered members will receive periodic updates, email communication regarding the activities of our group and our quest to achieve cost disclosure at point of care. sitinrx.com. Thank you.